I'll call the meeting to order at 6 o'clock on Thursday, September the 2nd, and turn it over to our Tri-Town Health Director, Jim, to follow the agenda through. There you go, Jim.
Thank you. Good evening, everyone. This is September 2nd, 2021, 6 p.m. Tri-Town Boards of Health meeting. And I'm going to try to pull up the agenda. If I can find it, it's buried. There we go. Just to make sure everyone's calling the meeting. Mr. Chair, you call the meeting to order. So the first item on the agenda is the 2:26:21 minutes. And for the record, Mr. Chair, I accidentally made a typo. It is actually January 26:21 minutes. And so I mistakenly made an error there, and I'll pull up the minutes real quick for the board. One second. And this was sent out previous to the meeting. Everyone should have got a copy of it. And if the board would mind entertaining review and any potential amendments.
I'll make a motion that we approve the minutes with the correction you just made, that they should be noted to be the January 26, 2021 minutes.
I'll second.
All those in favor?
Aye.
Noted. Thank you, Mr. Chair. And Mr. Chair, before we get to that, it feels a little clunky here, but I have multiple documents I'm trying to share with the board while we're doing this. Item number 3, which I'm going to pull up real quick, is the COVID-19 updates. If you don't mind, Mr. Chair, we have Kate Fletcher here from our tobacco awareness program. She's our manager, and item number 7 on the agenda was to have a basic discussion about potential changes to our Tri-Town tobacco control regulations. And since there's a lot of things we need to discuss related to COVID, I'm going to ask if you wouldn't mind moving that to the next item to discuss, so I can get Kate out of here and give the board a quick overview on that, if you don't mind.
And no, I don't mind. What I was going to suggest is that since we do, it is a complicated thing, and you sent out that mailing to everybody about the tobacco.
I did, to the board.
So okay, so we'll I don't see any reason, if there are objections from anybody, that we discuss this now and move the agenda item up.
No objection.
Okay, so let's go ahead with it then. I think that makes a lot of sense.
Thank you, Mr. Chair. So Kate Fletcher, welcome to our meeting. So for those that know, we're on our 27th year of our tobacco control funding, which we received from the Department of Public Health to provide education, outreach, inspection, and compliance checks in an effort to protect our young people and young adults from accessing tobacco, vape products, and other associated nicotine products. And if the board recalls, in 2019, we actually updated our local tobacco control regulations to restrict flavors, but we still allowed the menthols in 2019. And subsequently, right before the pandemic, the state, and I want to recognize State Representative Smitty Pegnatelli, he's on the call, and as well. And the state actually finally, after so many years advocating, passed comprehensive state tobacco regulations with a lot of restrictions, including a total ban on all flavors, including menthol, mint, wintergreen, and many other factors, including a very hefty fine structure. Because of the state passed the state regulations, that really made our 2019 regulations really way out of date. And so as we thought we were coming out of the pandemic, we've been hitting the ground running on education, outreach, inspections. We are still seeing a lot of black market activity. We're still seeing sales, unfortunately, and there's still a lot of work to do. And the intent tonight was to offer a draft regulation that I've been working with the state attorneys on to really present and kind of reconciles the state language into a local regulation with some additional new local policies I would want the board to explore. And if you look at the document that I sent you, you'll see a bunch of green highlighted sections throughout that draft. That is local policy decision updates. Like, for example, we have a cap on our number of tobacco permits we have in town. So for those, so say someone closes and no one captures that leftover tobacco permit, one option is we could retire that permit and slowly over time decrease the number of tobacco permits. And it's kind of peppered throughout others local policies. And I think for now, from a timeline perspective, I want the board just to have that document, maybe digest it, put some thoughts and ideas together, and then maybe we can reconvene in October and dive a little bit deeper into that process with the hopes of maybe having a public hearing before the end of the calendar year. And in light of all the COVID stuff we need to discuss tonight, I think I want to spend a lot more time on that, but not dismiss the importance of what we're trying to do with our local tobacco control. Because Kate Fletcher is, she's here and she's really hit the ground running since she took over for Ed Cedarbaum, who was our previous coordinator who had retired. And Kate's putting a lot of capacity and effort into education, outreach. She's recruiting youth to do compliance checks. She's seeing a lot of different byproducts out there now that we need to really get a handle on. And I don't want to waste Kate's time for belaboring the whole COVID thing, so she has other things to do. But Kate, I don't want to put you on the spot, but if you have anything to offer to the board as far as introductions and any questions, the floor is yours if you want to speak. But that's sort of like where we're at. And I just want the board to get a feel for like what the draft is going to look like, that I'm going to dive a little bit deeper in a couple months down the road.
Can I just ask Kate a question? Kate, would you, Jim is suggesting, if I understand this correctly, that we not really spend much time discussing this now. If the rest of the board agrees to do that, which I think they will because Jim is suggesting it, do you have anything to give us that you'd particularly like us to be thinking about as we look at this for the next time?
She's muted.
You're muted.
Yeah, not right now, just, going over it carefully. I've been going through it and it definitely is due for an updating. I fully agree with Jim on that.
Okay, so there's nothing, okay, so this is satisfactory to you then, that we'll just sort of delay this at this point based on Jim's suggestion?
Yes.
Is the rest of the board, board members in agreement with that? Does that
Yes.
make sense?
Yes.
Okay, so thank you, Jim, for that. Thank you, Kate, for that. And then we'll just put this on a future agenda. Thank you for giving us the information to look at.
Great,
Thank
Okay,
you.
so
I'll just add that if anybody has any questions for me at all, you know where to reach me. I'm happy to be available to help out with anything that you might need more information on.
so that would be a tri-town. Everybody could reach you at tri-town, correct?
Yep.
Good.
I am part-time, so you can reach me at my email, which is kate@tritownhealth.org.
So no weekend calls, right, Kate?
Not yet.
Any questions from anybody?
No.
Okay, thanks, Kate and Jim. Jim, do you want to move on to the next one, on the agenda?
Yeah, COVID-19 updates. Thank you, Mr. Chair. We also have Jill Sweet here is one of our 2 nurses that we've hired under the Southern Berkshire Public Health Collaborative grant. And Jill is working significant amount of hours in time with contact tracing and just so much other things. And I do have some data. Amy couldn't make it tonight because I'm trying to rotate the nurses out because they're really working weekends and a lot of hours, and I'm trying to keep them from burnout zone. So Amy couldn't make it tonight, but many of you have already met Amy, and there'll be other opportunities to bring her in. And Jill can give us a snapshot what she's seeing. but I do have some data I want to just pull up on a screen share just to kind of get the conversation going. The first is some local tri-town data that Amy and Jill have put together that kind of gives us a snapshot for July and August. Obviously, we're just getting into September, but you can see by the chart. Can everyone see this?
Mm-hmm.
Yes.
So, you look at Lee, for example, total cases in July 2 up to 36 in August, and you can see that the trend kind of going up. We've been able to look at the number of cases that were fully vaccinated, which are breakthrough cases, and those numbers are climbing in percent related to household spread.
So on average, Jim, are you saying that just about half of the cases were people that had already been fully vaccinated?
Looks like it.
Based on what Amy and Jill have given me, and Jill, you can chime in anytime since you're doing a significant amount of the caseload on contact tracing and investigation. I don't know if you have anything to add for the board on this data.
Yeah, it's a lot of household transmission. Delta's here. Once one person is infected, whether they're vaccinated or not, everybody is pretty much going through the household, which now we're starting to see kids. I've had a lot of contact with the schools, all the schools, including Great Barrington, just because of cross jurisdiction, having somebody test positive in Sheffield and playing sports at Great Barrington. Yeah, it's really.
Jill, can I just nail down this point very specifically, because we do have Representative Pignatelli here. Are you saying that about half of all these cases were fully vaccinated, and it's been with the Delta variant that they've been infected?
Unless there's sequencing done, I don't know for sure. If it's the Delta variant.
Half of these cases were fully vaccinated.
Yes.
And you know how many were symptomatic or how ill they were? Were there any hospitalizations?
I know of one person that was hospitalized after I contact traced on them, vaccinated. Yeah, it's household transmission. We're seeing a lot of.
Jill, are they receiving the monoclonal antibodies?
I am hearing that people are getting the monoclonal antibodies, yes.
Does anybody, I wonder if anybody here, perhaps Ray, you might be able to weigh in on this. Does anybody know if those monoclonal antibodies would be a supply factor? Let's say we saw a large number of cases develop. Ray, do you think that the hospital would potentially run short of the antibody treatments?
I know that hasn't been an issue so far. We do have nurses designated to, infuse the monoclonal antibodies. And I know that they have been actively doing that. I haven't heard any supply issues, but I'm not aware of any issues with that.
Well, of course, if we get a surge, that's one of the things that tends to be the case in some of these hospitals elsewhere, where they've run out of supplies. Of course, masking is a supply issue, respirators and occlusion of services, so that people that have regular heart attacks and regular pneumonia can't go into the intensive care unit because they're basically the beds are filled with people that are being treated for the coronavirus.
I would think that would be a question for Heather Barberry at the hospital. I could inquire.
Well, I'm surprised that the governor is not taking a greater look at this and trying to see that a little ways down the road this time instead of looking backwards, and actually taking more aggressive steps about limiting indoor behaviors by mandating masks indoors, by limiting public gatherings. Fortunately, this Tri-Town Health Department and two of the boards, the Lenox and the Lenox and the Stockbridge boards, decided a while back not to let there be full crowd gatherings, and that turned out to be a very good thing when you look at it retrospectively that we did that. I think that going forward, some of these figures are very ominous. There's a huge bump up in cases from July to August in Lee and Lenox in particular, and I think that this is something that we need to be concerned about.
I agree.
Is there any questions on this data set? And I'll pull up the Southern Berkshire dashboard. Okay.
No.
So some of you have seen this, Amy and Jill, once again, with their skill set as part of the Southern Berkshire Collaborative. We're going to be issuing weekly dashboards. And this encompasses the entire Southern Berkshire community. So it's not, it's hard to tease out just Lee, Lenox, and Stockbridge, but if you want to take a look at this, we will be sending this out on Fridays every week. We just started a new Southern Berkshire Public Health Collaborative Facebook page. In 2 days, we had over 2,500 respondents and engagement. So we're really picking up some momentum here. And this is something that the community is really asking for. We were hoping to not invest significant nurse capital into this, but I think it tells different stories, and it will assist us should we ever get to a point of made policy decisions. And when we met with the school superintendents before the state mandated the indoor masking at schools, Amy, Jill, myself, and others as part of the Southern Berkshire Collaborative have been advocating and working with the superintendents, and having this type of data assisted with decision-making with setting policies. So I think there's a lot of value in having this dashboard.
I think it's amazing. I think it's great.
This is all Amy. I'm just in awe of what she can put out.
Jill, we'll give you a pat on the back too.
Thanks.
It's so, and I can, and for those don't, if you go to the Tri-Town site, it is on there under the Southern Berkshire Collaborative page. We have asked towns to put it on their website as well, so it is accessible. And so really the next conversation piece that I want to kind of dive into is, like I said, Jill's doing 99% of the contact tracing, so she has a pretty good feel of what's going on. But it's been pretty well documented over the last few days with some of the things we're seeing. We're seeing cases in restaurants. We're seeing cases in schools. It was documented up in Otis and in other towns where there's been cases due to outdoor activities and events, steak roasts and other gatherings. We're seeing some cases in after-school programs. And while it's exciting that we have this Southern Berkshire grant and significant funding to help us build comprehensive nursing, Amy and Jill are kind of back to that point where they're just spinning their wheels a lot, putting a lot of energy into contact tracing. And I am working with DPH, and I'll be reaching out to Smitty at some point of trying to, build capacity and resources for the collaborative as we move on. But we're kind of back to where we were, just a short few months ago, where just, there's no state mandates other than specific indoor masking at congregate care and clinical settings and whatnot. And, some boards of health have issued strong advisories, and some are looking at mandates. And I know we talked about this concept at the Lenox Board of Health meeting, as well as the Stockbridge Board of Health meeting. And now we're here as the Tri-Town, and we got some challenges ahead of us. And, when we start to think about, the schools are required to indoor mask universally. Businesses technically can set their own policies by themselves if they so choose. We're seeing school districts implementing mandatory vaccinations. The hospital announced it. The cases are not getting any easier, and I'm not aware of any Berkshire boards of health that actually did a across the board mandate. And I think that's a conversation that I would like to have a discussion with the boards tonight on what that would look like versus a strong worded advisory that, I'm gonna offer the board first crack at what I would like to see happen tonight, but it's really up to the board to decide, and I'll pull it up in a couple minutes. But I want to offer the board and those watching from home, like the difference between last year when we're at a state of emergency in the resources we had to investigate and enforce all the COVID sector specific orders versus kind of like where we're at today. And so when the state of emergency was in place, remember that all the businesses were closed, basically, like nothing was open, right? Schools weren't open, restaurants weren't open. It was like takeout only, but that came after the fact. We never shut down as a department. So we had some staffing capacity to kind of respond to some of these community complaints. And while there were quite a few of them, all the restaurants were closed, and we weren't doing food inspections. We weren't doing camps. We weren't doing beaches. You know, thank God that's over with this week with all the bacteria issues we've had. And so, and on top of that, we secured over $100,000 in emergency COVID response dollars that helps supplement the staffing, backfill, overtime, paying Zach and others weekend time to update websites, respond, Q&A. So we had the staffing capacity and the resources to really manage COVID in the best way we possibly could. You know, we also had Department of Labor Standards, which is the state agency that has supported boards of health on some of this enforcement. And we've had a couple cease and desist orders that we asked the state to help us with. So there was all these resources and capacity to really respond to all the state specific guidance. Well, now we fast forward to now, we don't have that extra resources and funding to backfill and pay the staff overtime. Everything's open. The staff bandwidth is at max because we're back to doing our routine public health department inspections and complaints and housing and septic and whatever comes next. And my biggest concern is if we do mandate, which we definitely have the authority to do tonight, if the board so chooses, we just won't be able to respond like we did during the state of emergency, and it would be very difficult to enforce. And so I just want to lay kind of those variables out to the board as you begin to start to think about what makes public health sense for our communities. And I will pull up a draft public health declaration so the board can read. It's a little bit of a different format than I sent you early this morning. We've made some changes and modifications, but that's sort of like where I'm at. It's really what can we do as public health to try to slow the bleed a little bit? And you know, and part of that is really advocating to Smitty and to Adam Hines and others to really go to the state and help us figure out how we can deal with this, because we don't want to be behind the 8 ball once again. And I know there's vaccination access. We have better vaccination rates than some, but like just looking at the data and what's been happening just in the last month alone, it is a cause for alarm, and it's very concerning.
Jim, thank you. Would anybody like to weigh in on that before Jim puts up what he was talking about, his proposed resolution? Anybody like to say something about this?
Well, I think like we discussed at our meeting, it would overwhelm the Tri-Town Board of Health to try to enforce mandated masking, but I'm strongly in favor of coming out with a strong recommendation to do so. We don't want to overwhelm Tri-Town with trying to enforce something.
Anybody else?
What mechanisms do you have to enforce a mandated, or what kinds of mechanisms did you utilize earlier in terms of enforcing a mask mandate?
Great question, Dr. Black. So we had authority to enforce all the state of emergency orders. I will tell you, we did pretty well with compliance because the majority of the places were closed, but there were a handful of places that let's just say they had a hard time wrapping their heads around about indoor masking. In the carrot and stick for us, and Zach can jump in because he did a lot of these calls. You know, we would get a complaint, we would inspect, we would verify, and then, you know, there was progressive discipline involved. You know, we give a warning out and say, we're going to come back in the next couple of days. The next time you're going to get a fine. The next time you're going to be shut down. Your food service permit's going to be pulled. I will tell you, other than 2 or 3 documented cease and desist stories we had in Lee and Lenox, the majority of the places kind of came in line with indoor masking. So it would be, if we were, Dr. Westbeiser's trying to jump in. So the state of emergency order is gone, right? When the state of emergency mandates came out, it was spelled out under the governor's orders what the fine structure would be. So if we were to move towards a mandate, we would have to recreate under the general laws what the progressive discipline structure would look like on our own. You know, we can use public health laws to adapt to that, but it would be something we would have to look at.
Can I just say something? Just Dr. Westbeiser just joined us, I think. Is that right, Bob? We were discussing. Jim just presented some data showing increased cases locally from July to August, and that a significant percentage of these cases were in vaccinated individuals, previously vaccinated individuals. And you know, naturally, the idea of mandates comes up, but one of the things that Jim has been discussing for us is that Tri-Town right now, the nurses are involved in contact tracing. They're going to be involved in vaccination programs. They're going to be including influenza, I guess. The idea is Tri-Town does not have the manpower or the wherewithal to actually enforce a mandate at this point. And in contradistinction to at the beginning of the epidemic, the majority of businesses were closed by emergency mandates. So Tri-Town didn't have to be worried about those businesses, even doing the routine inspections that were usually there. And it took a lot of the burden down so that the actual enforcement of the mandate wasn't necessary that much. And instead, the staff could be directed more towards education and contact tracing. Is that right, Jim?
That's right.
So we're considering, and Ray has brought up the idea of some kind of resolution. So did Jim, by the boards that might be a mandate, or might be less than that, because the mandate might not be something that we could actually do in a productive way.
Just a quick question. If you chose to do a strongly worded recommendation regarding indoor masking, does the board have then also the ability to mandate that a copy of that resolution or some synopsis of the resolution be posted at the entrance of businesses, stores, so that people who are entering that become aware that the strong support for indoor masking? Or does it just sort of go out into the ether and sort of get dispersed?
We could put language in there requiring it to be posted at all permit. Now, we have oversight with hundreds of permitted Tri-Town establishments. You know, we could send it to the chambers and work through them as well to get it out to the other business sectors that we don't have oversight with, but we can definitely put language in there mandating that it be posted. Again, I mean, there's one piece would be the advisory, right, of the strongly worded, but then we could say this shall be posted in all businesses where there's employees. We can do something like that. And we can mess around with that language while we're on the call. But definitely we can look at that. Yeah.
That sounds reasonable to me.
I think
Yeah, it
that's
sounds like a
good.
very good idea, though.
Yeah.
Yeah.
It's educational as well as disseminate, just being more of an effective public notice.
And I think the other thing that one always wishes to keep track of here is that for at least another couple of months or so, there'll be a lot of people entering Price Chopper who are not local people, who don't get the Berkshire Eagle, who may not pay attention to what's going on in town meetings. So you want to have some mechanism in which you can put this information directly in front of them.
Mm.
And I think at the front door is the right place.
And it should be standardized, so people can see consistency for places that they're walking into.
You're saying like right at the front door. I mean, Price Chopper and several other stores did that the last time. I mean, it was very evident. They put up some kind of signage and they put the sign right on that. So you couldn't miss it. It wasn't like it was on a sliding door that when you opened the door, you couldn't see it anymore. You want a permanent prominence, right? I think that's what you.
Yeah, let me pull up the draft declaration and I'll show you like what we're thinking. And of course, it doesn't have the mandate of the posting on there, so bear with us, which is an excellent idea. So again, this is just a draft and the board does possess the jurisdiction to, pass this tonight, barring any amendments that you want me to make as we deal with this. So basically this, if you can see, if you take a few moments to take a look at this, let me know what your thoughts are.
Very good.
Sounds good.
It's fine.
Yeah.
Yeah, it looks very good.
And I can if the board, votes on this to also include a mandate that be conspicuously posted in all businesses where employees and public have access. I can work on that and make that happen.
Jim, can I ask a question? The one in two that says strongly recommend and strongly encourage. So
Yeah.
that's not saying that they have to do it, right? So,
Yeah, so this is-
if they don't do it, what happens to them?
Yeah, so this piece right here, Joanne, is just like a strongly encourage advisory, but I would make it clear in the language, say, now therefore, although the above is an advisory, but you are required to post this in a conspicuous location, or may be enforceable by relevant public health laws. Rather than throw a fine structure on there where it's like threatening, you can still be strong worded and still have a call to action to that. It's not perfect by any stretch of the imagination to have 3/4 of a document be advisory and one piece mandate, but I also feel, I feel there's value sending this message out, right? We're not gonna be able to go up and down Main Street and
Right,
check
'cause
this,
people-
but as the
People can
inspector,
also go to another town. They can ride to North Adams Walmart and shop instead of Pittsfield's Walmart. And they
Yeah.
could go to, Springfield or whatever, and they're not going to have the same mandates. But I just wondered why it was strongly recommended instead of something they had to do.
yeah, well, it gets back to the original comments I was making about the difficulty in having the bandwidth
Yeah.
to enforce a mandate. Because once you pull the trigger on a mandate, based on my most recent previous pandemic experience, we'll be fielding 100 calls a day. Because there are people out there that are really compliant with masking and vaxxers. And there's also a lot of people that aren't, and we will get those calls and we just can't, it will be very difficult on us to keep an eye. So then what will happen is we'll get all the calls, then we'll say, well, we can't enforce it. And it's sort of like, well, then why'd you do it kind of thing. And so I think if we find a happy medium and just, I'll make this language a little bit more consistent. It is a draft. We were trying to like just mess around with it like literally a couple hours before the meeting. And but I do like Dr. Black's thing about this shall be posted in all businesses in town or be punishable under relevant public health laws. I think this is a very good first step, because if things don't get better, we should definitely come back and revisit what a mandate could look like.
Would it be worthwhile to put in big bold letters in the top, public health advisory or something like that, just to get people's attention?
Yep.
Very big letters.
Yeah.
And then the second part, just to follow through on Noel's excellent suggestion here, how will you identify, how will the people be identified who are required to post this?
Well, the only thing I can think of is any business that has, where there's public access and employees. I mean, that's the easiest way of putting that. I mean, there's a lot of sectors out there, right? Like manufacturing and whatnot, that we don't really deal with on a day-to-day basis, but we'll do our best effort to get this out to our permitted establishments, because that can do that with a click of a button.
So can you say all established businesses and establishments that have received permits to operate under the Tri-Town Health Department are advised that they should post this in a conspicuous place near the entrance?
Yes, but then that covers a good chunk of the Tri-Town businesses, but there's a other chunk of businesses like barber shops, nail salons, manufacturers, regular retail that doesn't have food that we don't permit. So it's either kind of like a blanket way of all businesses that allow public access and or have employees must conspicuously post this, and then we'll do our best effort to get to all our permit holders. We'll send it to the chambers and say, can you disperse this within your networks? And we'll put it on the websites. I think Clarence is on here, and he'll capture some of this to get it out. I think we'll do our best to get it out to everybody. It's better than not doing anything at all. I think it's this happy medium that we can come to an agreement on.
So we have a couple of questions there, Jim. You want to take a look at those? You see them?
Let me stop the screen share first. Let me just see if I can open them. What is the definition of large event gathering? That is a really good question, Clarence. And I would, let me just look at the language real quick. Strongly canceling large event or gatherings indoors and any large event outdoors if social distancing will be difficult to maintain. That is a very good question. I could go back to the previous governor's order to look what the capping was. I know that Lenox and Stockbridge, by definition of the recent large gathering, was 9,000 or more. That's what we define locally. So we would have to, it's a really good question. I think I got to think about that.
Jim, is it worthwhile to define events based on percentage capacity of the, that the building has already as a permitted capacity? Now, buildings have a certain permitted capacity.
They do.
And a 50% capacity, I think, is a way to identify something that would be a large gathering, don't you think? I mean, I'm not sure what the rest of the board members think about that, but it seems like that we're not just talking about absolute numbers, we're also talking about the environment that the gatherings occur in. If you have
We said 9,000 for Tanglewood, so
Tanglewood,
that makes sense to do it for
Which was up.
the capacity.
Which is a 50%, yes.
Or rather than get into 50%, 60%, 70%, we can say where minimum 6 foot social distancing cannot be maintained per person.
That's good.
And then let the sizing of the business dictate itself. And again, these are advisories too. So we're not going in there measuring square footage. And the 3 foot social distancing is the school standard, but the universal social distancing is 6. So we could change number 2 to say minimum 6 foot social distancing per person based on the size of the event. And
50.
again, we're creating sausage here from scratch, so we just want to be clear and concise on what we're trying to do. Would that make sense? Because then you start saying 50% and everyone's gonna be like, oh my God, I just reopened and you're telling me I gotta close and.
Yeah, I agree. The percentage thing, a lot of people were confused by it even when it was in place. It seemed like hard numbers were better. You know what I mean? X amount of people at a private gathering and Y amount of people at a public gathering. That was a lot easier to explain to people that, well, 50% of my permitted capacity, but it says you can maintain social distancing too. Hard numbers are just a lot easier when there's a high volume of calls.
So Zach, do you think just saying, strongly encourage event planners and organizations to seriously reconsider postponing and or canceling any large event or gathering indoors and any large event outdoors if minimum 6 foot social distancing per person will be difficult to maintain?
I think that's good.
Yeah, because you've got if you can't maintain social distancing, that was another thing that towards the end of the governor's orders, one of the things is you could do it as long as you could maintain social distancing, and I think that's totally fine.
Can I ask, what would something like our apple squeeze fall into? How would you handle something like that?
Well, I don't know if Colleen Henry's on this call, but we had a conversation yesterday and I'm concerned about not only Founder's Day, but Apple Squeeze.
Yeah.
It's going to be, on one hand, we're not, and Jill, correct me if I'm wrong, we're not required to contact trace on outdoor events, but still, there's the potential of a public health disaster could be there, right?
Yeah.
Yes.
I'm amazed considering the current surge that they're still on, that they haven't been canceled.
No, they're moving forward. Well, the same as the Josh Billings, that's still going too.
Yeah.
Yes, Jim, this is Colleen. I am here. We are having a meeting. The Lee Chamber of Commerce is having a meeting tomorrow morning. That's why I wanted to listen to this tonight, to make a final decision about whether we will have our event or not. And I think that Clarence's question was a really good one. Outside events are a little more difficult to police and to figure out how many. We have thousands of people that come to Founders Weekend, and that's our concern right now. So I think that's a good question. I like the wording. I think it would be great, and certainly the Lee Chamber of Commerce can help you get that word out. I'm going to go back to mute now.
Yeah, in my conversation with Colleen, and not knowing what the outcome would be with the board tonight on this advisory is, I'm a public health person. To me, it doesn't make a lot of sense even to have thousands of people outdoors. We've already found clusters of cases with already outdoor events in other municipalities. And to me, it's like, I would hate to see fallout happen where we have businesses that are now shut down, local businesses that are participating in Founders Day. They're out now, and just we can't put that kind of burden on our public health nurses to try to mitigate multiple cases based on an event. And while on one hand, we can't tell people to not do it, but in the second hand, it's like, it doesn't make a lot of sense for me because the numbers are increasing. Even with outdoor events, we're seeing connections of clusters with outdoor events. So I think we're in this weird place.
I think that the last couple of comments have really highlighted the very ambiguous situation that we're all put in here. I don't think any of us here are enthusiastic about issuing any kind of mandate or any kind of restrictions on anybody's gathering. And I think that we're all very sensitive to the idea that most people have cooperated tremendously throughout this last year and a half to protect everybody else, to do the best they could, to try to keep their businesses going, to try to keep their lives intact. And certainly they're getting tired of this. And, you know, a lot of us were thinking when we got vaccinated that this would go away and that this would be the end of it, you know, and we'd be, you know, maybe we'd be having a little bit. Now we're in a situation that is reminiscent of the very beginning stages of the epidemic, the pre-vaccination stages. We're seeing people getting sick who have been vaccinated. And I think one of the things that I'm sensitive to is that I think that it's very important for us as a group of people who are focused on public health, who have a mandate to protect the public health, to make our opinions known about the situation going forward, about whether it's safe or not. I don't think that we can, and I think this is part of the reason that some of us have expressed hesitation about issuing a mandate. I don't think that we can abrogate the entire concept of whether or not people going forward want to do that or not. You know, I mean, this is another idea, and I don't think we have the total knowledge base to be able to, or even the mandate to tell people what to do completely. I do think we're at a stage where everything is, the writing on the wall is that the disease is going to get worse, and that that what we're talking about here is the best way for people to behave in order to not let it get worse. And I think that's what we need to transmit to people, is that this is what they have to do from that point of view. Then whether or not they actually do it or not, I think is going to be more the job of the people who they've elected to state government to run the ship, you know, to direct the ship. But we have to at least point out the clouds on the horizon, you know, and we see them, and we know the storm is coming, and we need to make this very clear to people. And I think that's the extent of our responsibility now. And that doesn't stop any of these other things from happening, but I do think we ought to be totally frank about what we think, so they know what we think. That's what I think we should do. I don't think we should hesitate to really give our knowledge its full swing here, because we do need to keep people advised about what's going on.
I agree.
I certainly agree with you, Charles.
Yes.
There is, I'm not sure that we ever got the genie into the bottle to begin with, but certainly putting the genie back in the bottle at this point is going to be virtually impossible. And we may have to settle for what we would settle for rather than what would be optimal. We're not in a position to mandate much of anything, but we can let our opinions be known, and the opinions be based in science. You know, fortunately, we have the vaccine where our disease among the vaccinated is looking good, but we're also allowing the virus to continue to spread and presumably mutate into something else. This one is already mutated to the point where it's much more contagious than the original strain. And it worries me a great deal. But I don't know that I can tell somebody else at this point, absent a mandate coming from a higher level of authority, that we would be at all successful. We'll have to settle for what we can do, but do it with vigor.
With vigor.
Yeah, so if I can just itemize some of the potential amendments, and there is a chat. Zach, hold on one second. I lost. Let me just stop. I'm gonna leave the share on there for a second. Change it to the 6 foot minimum per person social distancing. Talked about required posting at all businesses that allow public access and or employees, there's that. And there was, I can't, Zach, I'm gonna try to make you, if I can, the co-host, if you can pull up a chat for me, just bear with me for 1 second. I can't really see anything while I'm doing a share. There was another comment from someone else about symptomatic.
Yeah, I know.
We can expand number 3 a little bit, get vaccines, stay at home if people are symptomatic and or feeling ill or showing sign. Some people may not know what symptomatic is, unfortunately, but I could probably simplify number 3, maybe if that's what that chat was, Zach.
Yep. Yeah, include language about the being symptomatic.
Which 3 touches it, but we could definitely expand it a little bit more. And so that's sort of like what I caught for potential amendments to this document. And, you know, the conversation's still kind of working its way through the board. Whatever changes that you feel are necessary. I think this is a good call to action. And I think that's what my thought process was going into this meeting, at least something for now. And then as we move along, see what makes more sense. And, you know, and I did invite Smitty and Adam Hines on here because, they got their pulse to the grind at the State House, and who knows what the governor's thinking, what they're talking about. And 1 minute they weren't going to change the DESI guidance, now they are. And I did see some rumblings about possible daycares being required to mask, and we just don't know where the state is. And I figure that we would have learned, while on one hand, we may not ever get back to the state of emergency because with the fallout that we've experienced with the business and every other sectors, but mandating masking is not significantly controversial. I mean, from a state level, but I don't know what your thoughts were on what's going on in Boston.
Thank you very much, Jim. And first of all, I just want to applaud the Tri-Town Health Board and Department for doing a great job throughout this whole pandemic. With all respect, I think you're underestimating your ability to have your own set of guidelines stronger. If you're going to sit back and wait for the state, I think you're going to be sitting back for a long time. I think the board, the Tri-Town Health Board, Stockbridge and Lenox did a good job limiting the capacity at outdoor venues such as Tanglewood and the theaters. I think that was a smart move. We've seen in our weekly hospital call update just this past Monday, 2 days ago, that clearly the numbers have gone up. We had an outbreak in North Adams, as we all know. Although they didn't have any direct correlation to the downtown festival in North Adams and the Susan B. Anthony Festival in Adams, which attracted thousands of people. They didn't have any direct contact tracing to those events, but they've had amazing contact tracing tied back to families. Families have gotten infected as a whole, and I think that's a problem. So I asked the question at that call on Monday, we have Apple Squeeze, and I'm glad folks brought it up tonight, Apple Squeeze and Founders Day coming up. What should we do? I don't believe, and nor has the governor really mandated much that didn't prevent the local authorities from doing it even more so. So like I say, don't underestimate your own ability. Even when the governor did have mandates throughout this process, there were several communities that went above and beyond the governor's recommendations. So I think we could do the same. I'm glad Colleen's on the phone from Lee. I think the chambers of commerce need to be engaged. I think getting things on their website, I think, are critically important. And I think getting the local boards of selectmen on the same page as you folks. And I think our police departments could help enforce some of the mask guidelines. I mean, Clarence, you and I were at an event yesterday or 2 days ago with the Lieutenant Governor. And I know Chief Steve O'Brien came up to you and told you to get a mask on as you walked into the town hall. So I think there is the ability at the local level to do some good things. If we're going to sit back and wait for the governor, I think that's going to be a long wait. I think he's one of those guys that believes that I can make recommendations, but I'm not going to stand in the local municipalities' ways of doing something more if they feel that's needed. I'm very concerned about the number of people who are getting this Delta variant who are fully vaccinated. My cousin is one of them. I still call her my cousin, who runs the local housing authority. She's at home getting that therapy, but she's in her mid 60s and she's not well right now. And she's fully vaccinated. So I'm concerned about that regard. I think people have been pretty good about wearing a mask. Although I went into the Red Line Inn today for lunch, there was no mask requirement. So I think if we lay down a stronger guidelines with the support of the Chamber of Commerce, with the support of the Board of Selectmen, and partnering, you don't want to be the policeman going out there, giving people tickets, but we could be out there reminding people. I always, I look at the speed limit on the turnpike. That's really a recommendation. That's all it is. It's going to come down to enforcement. So let's have a strongly recommended mask requirement, no matter where you are, and have businesses step up with the assistance of the Chamber of Commerce and policemen walking around, much like they did with Clarence Fanto just 2 days ago. Hey, Clarence, put your mask on if you're going to come into the town hall. I don't think Clarence didn't take offense to that. It was a good reminder. We kind of took it for granted because Clarence threw me under the bus saying, well, Smitty doesn't have one on. And Chief O'Brien said, well, he's speaking. So I took it off to speak, but it was a good reminder to myself that, you know what, I had a mask in my pocket. Maybe I should put it on as well. So don't underestimate your authority. You guys have done a fantastic job. I'm concerned Tanglewood's now closed. The theaters are coming to an end. The summer camps are now closed. School is reopening. We're going to have apple squeeze and Founders Day weekend. What will our numbers look like if we're not careful in the next 2 to 3 weeks? And I think that could be alarming and could put an additional unnecessary strain on our hospitals and the healthcare system. So, Jim, with all due respect to you, I'm not worried about the strain on the Tri-Town Board of Health. I'm worried about the strain on the hospitals because we're getting complacent. We were letting our guard down. This variant is here. It's impacting the Berkshires. And I think we have some bigger issues to deal with that we need to get more aggressive with it right now. You have my full support, but if you're looking for some guidance from the DPH or the governor, I think we're going to be waiting a while. The daily numbers that we get, yes, people are still dying. We're in the 1,500 range of people being infected, but nothing like it was a year ago when we're getting 3,000 or 4,000 people a day being infected. So the numbers are not going to trigger anything aggressive, overly aggressive from the state. I think we should be very parochial, look at the local aspect of things. And you've got my full support and backing to do whatever you guys want to do with the support of chambers. The boards of selectmen need to be aware of this. The boards of selectmen are not talking about this variant or even thinking about requiring masks in our local restaurants in Lenox, Lee, or Stockbridge. I walked into a restaurant today, there was nobody even mentioning it, not even the hostess. So I think we need to do a better job collectively and do it on our own. Don't wait for the state to step in.
Well, I really like that, Smitty. I think I think there were two really good things about that. First of all, was your ability to bring a little sense of humor into something that has been getting the rest of us down for so long. So thank you for that. And I really do like the idea of we boards going back to our towns and actually bringing this idea back as a momentum builder. That we would, and I think we could use this initial resolution now that we're working on as a starting point. But I think that the idea here is we need to be very progressive and very stern. And I'm very glad that Representative Pignatelli is supporting our being up front about what we're afraid of, and that we are worried about these things. Now, I always got the feeling from Jim that he wasn't overly concerned about straining his staff, because I know he works them to the bone anyway. But what I think he was concerned about, and correct me if I'm wrong, Jim, is he didn't want to be in a position of having a whole lot of calls coming in from people who were expecting him to respond and do something about what we had mandated and then not follow through. That's I think that the idea was that we wanted to be we wanted to maintain our ability to do what we needed to do. And of course, we do need to do contact tracing. We do need to do the vaccinations, and those things are very important. But I think Smitty's idea for us to really get on the horse right now, we got to get on the horse now. We should do this resolution. It should be a very stern resolution, and we should plan to meet again periodically. And we should also go from this meeting with the idea of talking to our select board. I've already started to do that. I know our select board, even tonight, will be talking about this, and they're already aware of it. And I know that I spoke to Diane. I know that she's been interested in talking to her select board. I don't know what she's been able to do yet, but this is an entire community effort. And I agree with you 100%. This is where we do it. We do it in our local communities, and it's people like you, Smitty, that hit us on the head and tell us that's what we need to do, and that's why we do it. So thank you.
Well, if I could just make an additional recommendation, I think your resolution is good. I would maybe try to make it a little bit stronger. And then if your Tri-Town board endorses that, I would send that off to the boards of selectmen and asking them to endorse it at their next regular meeting to get that publicity out there. And I would also share it with the 3 chambers of commerce and ask them
How
to
would you make it
endorse.
stronger? How would you make it stronger?
Or would you do a mandate? That's the
Vaccinated
question.
on number 1. Get vaccinated is like number 3. Get vaccinated number 1.
Well, even the question, should we do a mandate? I mean, that begs the question.
What was Smitty thinking of when he said that? Did you have a specific idea in mind that you were?
Well, I think, words like recommend or encourage, they're kind of weak words. A resolution is just a resolution. It's not an enforcement tool. It's just that we strongly encourage during this period of time masking in all indoor settings. We strongly encourage limiting capacities for even outdoor venues. I mean, I just think it should be a little bit more forceful.
How about strongly advises? I mean, I think, this would be an advisory level, public advisory. Why don't we say strongly advise? And this brings into the arena our point of view and our opinions about it, which we have at this point. I think that I agree that encourage and recommend are very friendly kind of words, and we don't really intend to be friendly here. We want to be warning people. This is a warning. This is really what we're doing. We're telling people you better be careful.
I think the other thing, Dr. Kinney and everybody, is if I looked at your chart, Jim, where I think there was 4 people in Lenox and 2 in Stockbridge. And I mean, if I'm a layman looking at those numbers and I'm thinking, Christ, there's 5,000 people live in Lenox and only 4 got it. What's the big deal? I just think we need to have a little different approach. And I think the numbers are clearly going up. I would drive home the hard statistics with what's going on in Pittsfield with the Board of Health resigning. Dr. Kohlberg and Gina Armstrong resigning. The cases in Pittsfield are kind of a hot spot. That's going to have an impact on us down here in South Berkshire County if we're not careful without the oversight or that transition in Pittsfield. I think that's a concern. So I just think we need to paint a picture and share those hard statistics with the Board of Selectmen that, you're a town of 5,000 people in Lenox, but you know what? Your cases are up, not number 4, but your cases are up 29% in the last month.
Oh, no, there are more than 4 cases. I'm sorry. I don't mean, I think there are 4 workplace setting cases. I think what my point is, sometimes, statistics are good when you go with the bigger impact. So I'm just using 4 as an example that 4, that's okay. But in the last month, that 4 equates to, it's up 72%. Go with the higher impact instead of the lower number. It's still saying the same thing, but it's painting a different picture to the elected officials that, wow, this has gotten worse in the last month by 300% or 25%, whatever that number is. Just I think people need to be aware of it. I really believe people's guards are down. I'm fully vaccinated. I'm outdoors. What's the big deal? I looked at the Boston Red Sox. I mean, they have, I think, 8 or 9 players, and they had 3 or 4 staff
that have tested positive. They pulled one player right off the field in the middle of the game last night. But yet they're still letting 34,000 fans into the stands, and now they're going to require masking outdoors, waiting for your ticket, standing in line to go to the bathroom or to get food or a beer. But go back to your seat on a hot summer day when you're sweating, screaming at the ballpark, and you don't have to wear a mask any longer. It's contradictory what the Red Sox are doing. And that's in a much larger scale than Apple Squeeze or Founder's Day weekend. But I really think the town selectmen need to be aware of what is really happening here. Because I tell you, I don't believe they're even thinking about it.
Okay, Ray, you had something to say about it. What were you saying?
I was just going back to the draft and I don't know, Jim, was it number 3 that said, get vaccinated and stay home if you have symptoms? I feel like those are 2 separate things. I feel like the advisory should be get vaccinated. And, you know.
I can separate those, Ray, and prioritize those.
No, but to Ray, to be devil's advocate, and that's all I'm trying to do here, for the anti-vaxxers, and it's amazing how many of them are, especially in South Berkshire County, you're telling me to get vaccinated, but hell, my next door neighbor was fully vaccinated and she still got it. So what are you trying to do? You know, let's just talk real numbers. I would strongly encourage vaccination, but I don't think you can mandate vaccination. But I think we're mandating masks in the schools. I think that's a good move, and I see no reason why. And Diane Romeo was absolutely right. Every day I go to get my mailbox at the post office, they used to have a sign on the front door, mask required. I haven't seen one yet, you know. So having that sign on the door, if that's not in that business at the post office, hell, I'll just leave it in my pocket. That's the mindset. So I think businesses could step up with the assistance of the Chamber of Commerce. But make it a little strongly worded and partner with the chambers and the town boards of selectmen to say, we're doing this thing together. We are concerned. Our numbers are going up. And I would challenge anybody right now, not on this call, but out in the public. I believe next month we're going to see even higher numbers because Tango is now closed. The camps are closed. But we're going to have Apple Squeeze, we're going to have Founder's Day weekend, and we're going to have kids back in school. Our numbers are going to look very different from July to August, and then from August to September. I think we're going to be a little alarmed by that. Let's get ahead of it. Let's be preventive measurements and get people to buy into it for everybody else's protection.
Again, I question whether we should do a mandate, you know, knowing that maybe you can't enforce it 100%, but it's stronger than just an advisory.
Yeah.
Well, I think that's a good idea, John. I'm
knowing that it's going to get worse.
Yeah, I agree with you. I think that I think that we could put the ideas that we have heard tonight together in a very productive way. The first thing is I think we need to focus on doing whatever we're doing, whether it's a mandate or a resolution, so that it makes sense and people can understand it and it works. So I think that's the first job we have. We need to have language in this resolution that actually reflects what we're thinking in terms of what we're worried about. Then the second idea then is and this can be, I think we need to discuss this, is should we do a mandate, you know, which means that we issue an order and insist that the businesses do this, in which case, what Jim is saying is he's expecting to get quite a number of calls about non-compliance situations, and he's worried that he won't be able to respond to them, or if he does, he'll take these people away from the contact tracing or from some of the other things that we know are valuable. And we know that contact tracing is like putting a carbon rod into a reactor. It slows things down. So it's a valuable task of the Tri-Town right now that we don't want to compromise. The other part of it is, and I really like this idea, is to, and especially with Smitty's enthusiasm about it, I think we need to go back to our respective town governments and tell them what we're doing, and tell them that we want to do more, and that we want to stay ahead of this. And I think we should plan to meet on a periodic basis after we've gone to our town governments, perhaps even with them, and get them together so that we can have community input, and this should be done on a regular basis. We should agree to meet again next week and the next week until we get this down. Now, I'm not saying not to do the mandate now. I'm just saying, first of all, we need to get the language together about what we want, and we can either use mandate or we can use advise, but we need to get the language and what we want to say together so we can have something clear, and then we can decide what John is saying. I think John Kearns is that, do we want to mandate it or not? Do we want to, what level do we want to do this at? And then we go back to our communities with this and we say that this is what we're doing. And we want you to do it too. We want your support. We want you to do the same thing. We want to go beyond this if you think we can do it. And every week, let's do this so we can stay ahead of it. That's my suggestion at this point. I think we first need to look at what are we trying to say so that we know what we're saying. Scientifically, from the scientific point of view.
And if I could just add one more quick thing, I agree with Dr. Kenny and Dr. Kearns tremendously. I think if people understand it, the business community and individuals, if we don't do this now, the consequences, if things get worse, are we're going to be shutting businesses down, much like we did a year ago. That will have dire consequences to people. So wear a mask today to avoid a problem tomorrow. That's not too much to ask. I didn't want to wear a mask in July. It was too damn hot. But as it gets cooler, it's going to be a little bit easier to wear a mask. But I think the long-term consequences, if these numbers get worse, may possibly be a mandate from the government to shut businesses down, reduce capacity in restaurants, takeout or pickup only. Those had really negative impacts on people's lives. Let's not go back to that. So let's be preventive now. Let's be smart now to avoid these dire consequences in the next 2 months, 6 months, whatever this case may be, until we get that herd immunity.
Should we make a statement about saying something like, prior to issuing any mandates, these are our strong advisories, something along those lines?
Sure.
What if you change the words and just use different word, a synonym to advise, like I instruct, we instruct the businesses, just change the word so it sounds more forceful instead of advise. I mean, advise, to me, that's what I was asking before. If you say we strongly advise, people aren't going to take that word advise and go with it. They're going to say, oh, they're just advising. We don't have to follow that. But if you say, the Tri-Town Board of Health instructs the businesses to, they or some other word that's a little more forceful, but not quite to the mandate yet.
And Joanne is absolutely right. So how you word it, and then if you get the boards of selectmen to maybe even be a little stronger, so have it be tiered. So you guys do whatever you want to do with your language. You get the boards of selectmen on board, because the boards of selectmen have the ability to reduce capacity in restaurants. They could reduce the hours. So do this now to avoid future dire consequences down the road. I think having a collaborative approach, so we're not just pointing fingers at Jim and Tri-Town Health and you folks on the boards. It's a collective community concern that let's do this together to avoid something worse even happening with restrictions that we don't want to go back 8 months.
So something to say.
I think based on, go ahead.
I can tell you in East Long Meadow that they were requiring face masks. I was out there doing clinical hours to finish up my master's program, and I would stop at Starbucks, twice a week on the way home. And you would see the signs in the beginning, whereas masks are not required unless you are unvaccinated. And then a couple weeks ago it was masks are required regardless of vaccination status. So it can be done. It's being done in other communities. So it's just maybe pulling the trigger and doing it. Making it a requirement.
I was impressed by what Smitty said. I think all of us in our hearts know that a mandate is correct. We're just a little timid about going about it.
So here, me offer a couple thoughts so we can kind of tie this up. And I agree with all of this, we want to make the language stronger. We want to kind of clean up the language. I think we want to try to settle on some type of very heavy-handed document tonight, because I think we don't want to push this out any further, because between posting requirements, availability of the tri-town boards, we can be weeks down the road. But what I also could do is taking Smitty's and other points is at the beginning of it and say, in an effort, we want to say something like, if we don't do this now, the Tri-Town Board of Health will be implementing mandatory requirements such as X, Y, and Z, like reduction. So it's, you're
Yes,
saying,
yes.
do this now. We're instructing you to do this now to avoid further consequences down the road. And then we clean it up. We, you know, and I would probably maybe not mandate it today because I need some time to fiddle with the language, and maybe the 7th, but the day after Labor Day, make it official. I can put the data that Amy and Joe put together with the percentages plus the Southern Berkshire chart with a cover letter on top of all the documents and get it to each select board and say, on behalf of the Tri-Town Board of Health, we're asking you to put this on the agenda to endorse this declaration immediately to avoid further action taken by the Tri-Town Boards of Health should the trends not be in our favor from a public health perspective. So I can tie all that up neatly, but I think we need to work on that. We need to we need to be on the same page and approve this tonight. So it gives me the weekend to get it all together to make it live on Tuesday.
Okay, so I just want to bring to the board, I want to ask the board this. The first idea is, and I just want to get a head count just so we can see where we're going to go with this right now. Do we agree that we want to get together a statement that Jim will polish off a little bit and then post later on? Or do you want to see the final copy before you sign off on it? So can I just have you know, like a little roll call vote here? I'll go down. Just tell me if you want to settle it tonight or if you want to let Jim work on it and then come back and we'll have another Zoom meeting to look at the final wording to see if we want to authorize it. I personally trust Jim. Diane, what do you think?
Thank you. I'm torn on this. I want to see something done as soon as possible because I think Jim's right. How long it takes to have us get back together. We could, it may be after the apple squeeze before we manage to get our act together to get back together. I hope not. I guess I'd lean towards Jim, trusting Jim to get it done. Because I don't know how easy it would be to get us back together.
John?
Yes, I agree with Jim, taking care of it.
Okay, and Noel?
I trust Jim.
Okay, Hank?
Yes, I trust Jim also.
Okay, Ray?
I agree with trusting Jim to get it done.
Marissa?
I trust Jim.
Joanne?
Right.
Trust Jim.
And
Jim?
Bob?
I think we should talk about the pros and cons of trusting Jim. Of course.
Okay,
I mean,
so, all right, but let's just polish off the wording, and that, Jim, if you could just run down what you're going to be saying so that everybody is on board about it. And then we can decide, I think, as a separate issue, do we want to mandate something tonight using all of those principles? Or do we want to simply issue a strong advisory or some sort of instructive message? Or we can use whatever that particular active action verb is that we want to put this together on. But what I would say is that we ought to get does everybody know what I'm talking about there? What I mean, there are a lot of different principles like vaccination, you know, wearing the mask and things like that. And then we can decide after we've polished off and we're giving Jim this language and he's going to go into it and we're going to trust him. Then what we're going to do is we're going to say what level of authority do we want to exert at this point about that? Okay, because I think that's a separate issue. Does anybody disagree with that idea, or how would you like? What do you want to do? Sound like a good way to proceed?
Yes.
Okay.
So let me go down the items so I took a bunch of notes. There's a lot of dialogue going on. We want to clarify the gathering 6 foot per person if you can't social distance. I like Joanne's point about instructing. You know, it doesn't say mandate, but it's a heavier hand than advise. I'll clean up the beginning language saying to avoid further mandates that may include capacity reductions and other things. You know, we're instructing the business sector to do this to avoid further actions taken by the Board of Health that may include mandates. I'll kind of clean that up a little bit. Kind of clarify the vaccination, kind of itemize the priorities there. It's sort of like what I got, and then and just make it official for September 7th, which gives me the weekend to sort this out, and then really tie it together with the data, go by the percentages of the number vaccinated, the total number of cases. Amy could probably pull something out of Maven, or Joe can pull something out of Maven early next week. I know it's a holiday weekend, but we can sort that out, and then really send it to the select boards and with a separate cover letter and say, please find the enclosed public health declaration in an effort to minimize the impact. We're asking you to endorse this at your next select board meeting, because if the numbers don't improve, the boards will entertain an official regulation mandate that will be enforceable if we can't collectively work together. So sort of like big picture, some of the changes that I've heard tonight.
How does that sound?
Sounds good.
Good.
Okay, now what verb are we going to use? Are we going to instruct? Are we going to advise? Are we going to recommend? Are we going to beg? I mean, what are we going to do?
I like instructs.
Well, Merriam-Webster words that go with advise, that's what I've been looking up and see what the best words are. They're all pretty weak, other than, pilot, steer, familiar, they're all real weak other than instruct. I'm thinking you're instructing somebody to do something, means they need to do it.
I have a suggestion. We could use the word direct. We direct you to do
Direct
this.
is good.
It's just below a
It's even
mandate,
better than
but it's above instructing somebody to do something.
Yep.
it is.
I like that.
It's very direct.
Good.
Put in a 4-letter word.
Okay.
Hey, Jim, if you don't mind, if I just have a thought and a suggestion. Jim, my thought is, with so much trust, I'd ask for a pay raise at your next meeting, number one. But I think this letter going to the Board of Selectmen is going to be critically important. In asking them to endorse it. I would encourage you to send a letter and ask for their endorsement from the Chambers of Commerce Board of Directors. And I would also share it with the school committees, not for an endorsement, so to speak, but the fall season is upon us. We're going to have outdoor sporting venues. People there again, the guards are down. Hey, I'm outdoors. What's the big deal? So just making them aware of it on the school side of things, I think would be very important as well.
Okay, thank you for that. Now I have a question for the boards. My own, just thinking about, procedures. It seems to me that we need to set up a schedule of meetings for a few weeks that where we can anticipate that we're going to have a meeting to follow up on what we've accomplished up to that point, so that we can pick up the slack, so that we can make sure that we keep this ball rolling and that we don't languish. So I would like some suggestions about how frequently you think we should make these meetings happen. Would 1 week at a time, every week be too frequent? Every 2 weeks? What are your suggestions about this?
I mean, I can do a doodle poll first thing tomorrow and set up the next meeting 2 to 3 weeks out.
Mhm.
I mean,
That sounds good, Jim.
because
I wouldn't go any further than 2 weeks out.
Yeah.
no more than 2 weeks.
No more than 2.
I can do that.
I'm glad everybody is, at least a lot of people are thinking 2 weeks, because I think if we go 3 weeks, it becomes 4 weeks sometimes, and this is the kind of, we don't have to meet very frequently. It's not like we're burdened with a lot of this stuff, but this is the time when we need to get the job done. And so we get our job done now, and then we don't have to do so much work later on. It's easy to cancel a meeting. It's hard to set it up. You get the meeting set up, and everybody's got to figure things out. But canceling it is, you can just, you can go out and have dinner or something. But the idea of getting the meeting in place, I think, is very important. So can I have a roll call vote on meeting in another 2 weeks? How many people are in favor of that?
Aye.
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 Okay, anybody against it? Okay, good. So
Jim.
Jim, let's get this set up so that we'll meet again in 2 weeks. And in the meantime, you'll have this set out. We'll set it up. And I'm just going to ask everybody on the boards to speak to your local community governments and get involved in getting all of the different people. I know, the select board, but you have your emergency management guys, you have your police guys, you have your fire guys, your EMTs. They're all going to be getting involved in this as time goes along. We already went through this. I mean, we just went through this. So we already have it. We know what we're supposed to do and we know who we're supposed to talk to. So let's just tell them, sorry, we got to wake you up again. There's another call down in the ER. We got to go down there. That's the way it is. Just go down. You got to do it. This is our call. Right now we're on call.
Jim,
Yes.
if it's any help to you, I'm working on Labor Day weekend as well.
Thanks.
Okay.
And I'll make sure I put that pay raise on first thing on the agenda next meeting, so.
Well, I know why John Kearns doesn't mind a mandate, because he's a surgeon just like me. We used to wear masks all day long. I mean, it didn't bother us. In fact, he's probably happy to make everybody wear a mask.
All right, so I'll spend some time the next couple of days. I'll probably have something by like late tomorrow, and I'll fiddle with it over the weekend, sit on it, and just kind of regroup and get that taken care of, and I'll get that out and make a. So is the board in agreement making it mandatory? Maybe like the day after Labor Day, which would be the 7th.
Yes,
I can make that happen on sometime on the 7th.
okay.
Is there, so maybe an entertain a motion to approve the ratification for September 7th?
So
I
moved.
make that motion. Second it.
Second.
So moved.
All right. That's settled. I know there's a couple other items on the agenda, but if the board doesn't mind, we're an hour and a half in. There's nothing really pressing to really update the board other than the goings on of Southern Berkshire Public Health Collaborative, and we're doing really great work with our new.
I'd like to bring up one question that one of the members of the audience brought up, was a question about what the members thought about what kinds of qualities of masks we were interested in.
Not only quality of masks, but you don't know, I'm sure you've all seen it. How often do you go in and people don't know how to properly wear the mask they've got on? There's still a lot of education that's got to go around it. And a lot of people, it's down under their nose. I was somewhere this morning where they had it rolled up so they could talk out of their mouth. And I'm thinking, oh my God.
Diane, one of the many edits I have to make is I will put clarification about proper wearing of masks.
Oh, thank you.
And I'll put the CDC web link to the website. There's some
Okay.
really good CDC stuff, unless Jill, there's better information out there for links, but I can add that I can sprinkle some of the educational resources into that. To say, for proper fitting and wearing a mask, please visit this website. I can do that as well.
Thank
I
you.
think that's the way to do it.
I was in CVS and somebody that worked there said, have his mask down out over his nose, and somebody told him to put his mask up over his nose, and he's like, masks don't work.
Yeah, that's why. That's why.
Exactly.
But it's very, it could be very confrontational, because we were in Connecticut with with a person, and they approached another person in a Lowe's and asked them to please pull their mask up, and it was not a pretty picture, the retort to that. So I think people are scared to tell other people what they need to do. That I think you need, again, that signage up, like you said, a prominent sign that says masking, maybe underneath it or further in, and this is how you do it. Just some simple instructions, nose here, mask here.
I think there's so many contradictory rules about these things. Like even us in school, we only have to stay 3 feet apart from each other. So you're going to have public gatherings 6 feet apart from each other. And people are going to say, God, the kids don't even have to stay that far apart in school. And when they go out to recess, they don't have to wear masks. They don't have to social distance. So none of it makes sense, because it's all these contradictory things.
Yeah.
And you go into Walmart and it says to wear a mask, and you go in and half the people have masks and half the people don't have masks, and no one's enforcing it. So people are just saying, well, if they're not going to wear a mask, I'm not going to wear a mask. I went into post office today. They don't even have masks on in the post office.
Jim, back to the proclamation, is the intention to mandate that we put the whole thing, that the whole thing be posted? Because you have already several hundred words, and now it sounds like it's going to be longer, plus instructions on how to wear a mask, when really our main point, once somebody's at the front door of a facility, is for them to wear their mask. I mean, we can say we're instructing, directing people to get vaccinated, but that's not, that will have not a lot of immediate impact right then.
Yeah.
So do we need like a sign that says mask up, or do you want to put this whole thing with highlights? Just, we don't have to do that tonight, but have that in mind, impact and readability. If it's several hundred
I think that's
words,
too much
we're gonna lose
for
the
people.
effectiveness.
Yeah, it is too much.
Bob,
Too much
this
for
is
people.
the
They just
forest
need
for
to
the
see
trees.
wear a mask.
Bob hit it
And
right in the
front
mark. We're missing the forest for the trees. He's absolutely right. We should synopsize this and just have a very basic thing. He's absolutely right.
Wear a
What
mask.
do we want
Wear a
to do?
mask.
Just wear a mask. The
Mask
boards of health-
required.
The
Yeah.
boards of health direct you, if you enter this facility, to wear a mask. I mean, something like that that's very strong. And forget about the rest of the trees. Bob's exactly right. Why do we need all
the
this?
proclamation? I like that we're coming out with several points, but I'm just talking about the impact of getting to that door. Speaking to Noel's original point earlier in the meeting, and that was, a lot of people aren't going to see the eagle, they're not going to hear this. How can we reach them? And speaking to that original point, I think it can even be highlighted. It can say at the top, wear a mask, etc. See below if you're interested. I don't know. But think about that as you're putting this finalized draft together. And I'm
Yeah, what we could do, and I'll have Zach chime in, what we can do is, as part of the declaration, under the mask wearing, say, please post this sign conspicuous, instead of the declaration, please post a stop sign conspicuous location. We can find the most up-to-date, easy viewable signage. We can put it on the website and include it in the packet, rather than have this long worded document.
Yeah, you want it simple.
Now
So-
in Cummington, we were in Cummington, the creamery up in Cummington today, and posted on the front of the door, as Bob is saying, green piece of paper with a big mask. On the top, it said, wear your mask. Underneath, Cummington Board of Health, as of this date, you must, they mandated it in Cummington. But I
Yeah.
mean, when you came to the door, you just saw that picture of a mask and it says, wear your mask.
That's what we need.
How many
Yeah,
stores are in Cummington?
I think just the Crescent, I just think the creamery.
And can you include it to be on like a neon, like, neon is like the best, a neon paper, and say, per Board of Health, you must wear a mask.
Yeah, we can, Zach,
Really
between
simple.
Zach and I, we can figure something out.
Yeah.
Yeah, we'll make it neat, clean, easy to read, so people can read it as they're opening the door, We don't want people congregating in front of the door to read the sign,
No.
but it'll be good.
Okay.
Okay, so Jim suggested we skip the last points on the agenda related to what were the Southern Berkshire, and what else was that, Jim, that you recommended skipping over?
Remote meetings.
Oh, I know, well, the remote meetings Hank brought up at the
Remote
Stockbridge
meeting,
meeting, but maybe we can, it's just really and I won't speak for Hank, but he brought up the point at the Stockbridge meeting about really supporting a continuation of remote meetings, because it really increases accessibility.
Transparent.
Transparency.
Yeah, and it's on CTSB. We're getting a lot of people engaged in our meetings, and just while we're still beholden to the open meeting law, and if the governor says, no, you can't anymore, we can't, there's not much we can do. But it's really advocating to Smitty and others at the state level that, which utilizes technology, because it's more inclusiveness, openness, and every meeting's recorded now. It's on local access TV. I felt the significant increase in participation, not only with Tri-Town, but all the other individual board meetings I go to. And I really enjoy at least some type of hybrid level of meeting. It makes life a lot easier for us.
Absolutely.
All right, well, thank you all for tonight. Does anybody have anything, any new business they'd like to add that before we adjourn?
Mm-mm.
Well, thank you all for your participation. We'll be having a meeting then in about 2 weeks. Jim will send us the agenda for that. And in the meantime, I encourage you to speak to go back to your local community governments, and let's get ready to push this rock up the hill.
So move.
So move.
All right. Good night, everyone.
Thank you.